Here's how you can structure your study week around the blueprint. If I were you, I would take a typical Monday. I'm going to focus on acute presentations like sepsis, trauma, altered level of consciousness as stated in the MCC objectives. And then on Tuesday, I'll take conditions like, chronic management of conditions where I look at guideline-driven care for things like diabetes, hypertension, COPD, major depressive disorder. Then on Wednesday, I will look at preventative care, so screening, immunizations, lifestyle counseling. Then on Thursday, I'll look at concepts like ethics, communication, psychosocial care, tackle sensitive and judgment-based scenarios as well. And then on Friday, I will do simulated MCQ blocks. I'll review, I'll make sure they are timed, they are focused, and they look like the exam. And this is where I'll really encourage that, please, the Medical Council of Canada has set their own wonderful questions on their website. Get some money, buy it, do it at a timed pace, because that is as close to the exam as it can get. And then what do you do on Saturday? So usually I prefer to rest on Saturday to reconnect. I empty my head, no studying. And this is crucial for long-term retention and mental clarity. Remember, you are doing this for about 6 to 9 months of exam preparation. And then on Sunday, you can review your weak areas, revisit your blueprint zones, and tighten the loose ends. This plan I'm giving you isn't about intensity alone. It's about strategy and sustainability. So the important point and the important tip I want you to take is this. You don't need to study everything. You need to study what matters most. And what matters most is what is in the MCC objectives. So you have to let the exam blueprints guide your priorities. Let real clinical scenarios sharpen your judgment, and let a structured plan replace overwhelm with control, because many candidates overwhelm themselves with many textbooks and they want to read cover to cover. No, rather use those textbooks as reference materials and pick the objectives one by one. So if, for example, you pick chest pain, what are the topics on the chest pain I need to know? If you go to the MCC objectives, you realize that there are components under each objective. We call them enabling objectives. So look at the topics which appear under the enabling objectives. Now go to your beloved textbook, okay, and rather focus on those topics. So you don't need to read everything under cardiology. You don't need to read everything under gastroenterology. No. The exam has focused applications and focused topics based on the objectives, and that is what you need to focus on. And if you want more structure, we've created something at MedCognito for you, which helps you to structure your learning in a 3-month fashion or a 6-month study plan. And it is customized to teach you what to study and which MCC objectives to focus on each week. So we've done all that work for you. It's the same system that we've used to help hundreds of candidates to track and pass the MCQ1 confidently. So the MCQ1 is tough, but it's not vague. It's clear and it's structured. And with the right strategy, you can absolutely pass this exam.